Passengers thought it was the flu. It was hantavirus. At first, nobody on the cruise ship was worried. People get sick on cruises all the time. A cough here, a fever there. Maybe bad food or flu. But this felt different. It started with just a few passengers complaining of headaches and exhaustion. Then came the fever, muscle pain, chills. Some became so weak they couldn't even leave their cabins. Still, most people weren't panicking because the symptoms looked ordinary. And that may have been the most dangerous part. By the time medical staff realized this wasn't the flu, it was already too late for some passengers. What they were dealing with was something far more rare: hantavirus. And the discovery triggered an international health investigation. Cruise ships are basically floating cities. Thousands of people packed into tight spaces, shared dining halls, shared air systems, shared elevators, shared everything. That's why outbreaks spread fast. And on a crowded cruise ship, surrounded by thousands of travelers, the last thing people expect is a rare viral infection like hantavirus. As more passengers started feeling sick, concern began spreading across the ship. People started avoiding crowded areas. Some stayed locked inside their cabins. Rumors exploded online. Was it food poisoning? A new COVID variant? Something airborne? Nobody seemed to know. Then health authorities became involved. And suddenly, this wasn't just a routine medical issue on a cruise anymore. It became an international public health concern. Experts started tracing where infected passengers had traveled, who they interacted with, and whether others may have been exposed before symptoms even appeared. Because when an unfamiliar virus appears in a confined environment, officials move fast, especially after the world learned what happens when outbreaks are underestimated too early. And while you're watching this, comment below. Do you think cruise ships are prepared for outbreaks like this today? Now here's the part that truly worried experts. Most hantavirus infections are associated with rodent exposure, but certain strains, in very rare situations, have raised concerns about possible person-to-person transmission. And even the possibility of that happening inside a cruise ship was enough to trigger a serious alarm. Because cruise ships create the perfect conditions for rapid spread: thousands of strangers, constant close contact, international travel, limited isolation. It's the kind of environment epidemiologists pay very close attention to. Fortunately, hantavirus remains rare. But cases like this are reminders of how quickly ordinary symptoms can hide something much more dangerous. A headache, cough, fever, things people ignore every single day. Until suddenly, they can't. And perhaps the scariest part of all, the first signs looked so normal that almost nobody realized what was happening until the situation had already escalated. Because sometimes, the most dangerous outbreaks don't begin with panic. They begin with people thinking, it's probably just the flu. The best way to reduce the risk of hantavirus infection is to avoid exposure to rodents and contaminated environments. That includes keeping living spaces clean and well ventilated, sealing holes where rodents can enter, avoiding direct contact with rodent droppings or urine, wearing protective equipment when cleaning contaminated areas, and disinfecting surfaces properly instead of sweeping dry particles into the air. Because with viruses like hantavirus, prevention matters far more than treatment. And sometimes, the most dangerous outbreaks begin with symptoms that seem completely ordinary. If this story shocked you, share this video with someone who travels often, because most people have never even heard of hantavirus until it's too late. If you enjoy true medical mystery stories and real outbreak investigations, subscribe to Science of Us Story for more videos. Thanks for watching. See you in the next video.